India is under the grip of COVID-19 pandemic and the scenario seems to be worsening as days are passing by. One fear that circulated among the people and the government is the lack of availability of beds at hospitals across the country to keep the patients in isolation. The Prime Minister of India, Narendra Modi, in a bid to meet the shortcoming of beds in the hospitals, thought of an idea that could possibly solve this issue in the country. India houses the fourth largest railway network in the world by size. The Indian Railways currently holds over 76,000 passenger coaches. Since the outbreak of the pandemic, the railway services in India has been suspended, which means that there are vacant coaches across India, which can be used as isolation centers for the COVID patients. Piyush Goyal, the Indian Railway Minister under the aegis of Prime Minister Narendra Modi, started to convert the railway coaches into COVID care coaches or COVID isolation coaches at zonal railway workshops spread across India. These are developed as COVID care level 1 centers as per the Health Ministry classification of COVID facilities, where suspected cases or those with mild symptoms are to be kept. Suspected and confirmed cases will be kept in separate coaches. The coaches selected for conversion are non-AC sleeper class coaches, as air-conditioned environments might aid the spread of the virus. Well-ventilated area environments were thought to be more safer. Each sleeper class coach is divided into 8 cabins. The idea was to remove the middle berths so that each cabin could carry 2 patients on the lower berths, a capacity of 16 per coach. 2 of the 4 toilets are converted into bathrooms and the windows are covered with mosquito nets. Power plug sockets have been installed for medical equipment and plastic curtains were installed in every cabin. There are also oxygen cylinders and fire extinguishers in each coach. The total expenditure for converting a single coach has been estimated to be around 2 lakh rupees. To reduce the summer heat in the coaches, the roof would be insulated in a number of coaches. Railways have attached an AC coach as well for doctors and medical staff. Each isolation train will be tied to the nearest hospital. The center will deploy these coaches after state authorities request for them. Railways will maintain the coaches, provide linen, and may provide food depending on feasibility if requested by states. It was proposed that some of these coaches should be upgraded to hospitals with oxygen, ICU, and ventilator facilities with the help of private hospitals and make them Level 2 and Level 3 COVID care centers. The Indian Railways have deployed the isolation coaches across the country and pledges to provide more of them as per requirement.